how soon. My doctors, when I've had them, they wanted me right the next day. They wanted me to get in there and start moving the knee.
So we got you one beat. We do it the same day. We actually have a therapist.
Is that new?
No, I mean, again, it depends on, and all of this is, it's kind of difficult when you're going into surgery and you see all these different protocols, but really each surgeon has their own protocol. Some physicians don't want you to start therapy for a week or two because they want, I don't know, healing to kind of set in or whatever. But our personal protocols, we start them in therapy that same day. We have a therapist see the patient before they go home. They already start working on home exercises immediately. And we have them starting physical therapy 2 or 3 times a week, as well as doing home exercises right out the gate, really.
How many times a week?
So they do the PT at least, the physical therapy at least 2 to 3 times a week. We want them doing their home exercises on the days they don't go to physical therapy. So now, granted, those exercises when you're right after an ACL reconstruction are not, you're not doing squats and lunges out, your first week post-op.
Oh, come on.
But you are doing, it's good, but it's not that good. You are doing, leg raises and quad sets, basically flexing the quad muscle, trying to keep the muscle from atrophying. So that, because the main thing that's going to stop you from returning back to activities as our protocol goes, is if your muscles aren't there. So if your motion isn't there, your muscles aren't where they're supposed to be, then we hold you back before we progress you in our program.
So you want to build up strength, but you want to build up stability.
Mm-hmm.
So, and there's obviously different exercises for both. So what kind of exercises would you suggest somebody who wants to rebuild that stability in the knee?
So, strength and stability kind of go hand in hand. If the knee is strong, it should be stable. So especially for anyone who does a lot of jumping or landing kind of activities, you want to build up the quads and the hamstrings. So exercises for those are going to be your squats, lunges, leg press, hamstring curls. Those are, especially for, as we talked about earlier in the segment, in the program, about females who have a tendency to hyperextend their knee, or that jump training, that video that we saw, if they build up their hamstrings and really have strong hamstrings, it'll prevent the knee from going into that at-risk position. So doing a lot of conditioning for the sport is going to be very, very key.